Welcome back to Diabetic Foot Files in this series because you notice that I've been focusing on disability because it's actually quite complex. We've been walking through the questions that live underneath the diagnosis of diabetic foot ulcers, not just the medical questions, but actually the life questions. And we're trying to cover disability, time out of work, and whether somebody can continue working at all. Actually, it is quite interesting. And now we arrive to another emotionally charged concern that patients rarely say directly to the doctors and is, doctor, if my job finds out about this, am I going to lose my job? And this question comes out quietly, sometimes after the visit even is over, sometimes while the patient is putting on their shoes, they sometimes never even ask it at all, but it sits in the room. They ask that in their mind. They do ask that question in their mind, even if they don't ask it verbally, okay? So the fear behind the question. So most patients aren't just asking about firing. They're asking, will I lose my income? Will I lose my insurance? Will I be able or will I be seen as unreliable? Will my employer think I'm a liability? Will I be replaced while I'm gone? So a diabetic foot ulcer doesn't just affect the foot, it affects the patient's identity at work as well and identity in society. It affects their own identity. It creates this uncertainty in systems that often prefer predictability. And when people feel uncertain, if they fill the gaps with fear. So, here is something that patients are often surprised to hear. Most employers, this is, I'm not sure, let's see. Most employers do not want to terminate someone who is temporarily unwell. Okay. Why? Because hiring and training new employees is quite expensive. Replacing experienced worker is quite disruptive, and in many roles, continuity matters. Just like continuity of care in medicine matters, continuity matters in the whole. So, from an employer's perspective, a good outcome is usually the employee recovers, they return safely to work, and resume work. Okay. And firing is typically not the first response, I would hope. Okay. But it seems like the world is a little bit extra callous right now. And it's usually the last resort when there are no alternatives existing. So, what are employers actually evaluating? Employers are usually not thinking in medical terms, right? They're thinking in functional terms. So, can this person safely perform their essential job duties? Can that person meet productivity expectations? Can that person do their job with or without accommodations? Is there a safety risk to that patient or other people at their job? How long will they be unavailable for the job? So, a diabetic foot ulcer becomes a workplace issue when it affects the patient's function, it affects the safety, and it affects the patient's attendance as well. So medical leave. So in many workplaces there are formal protections for medical conditions. These may include short-term medical leave, family and medical leave policies where they are applicable, sick leave accruals, disability insurance benefits, occupational health programs. These systems exist because illness and injury are expected parts of human life. And a diabetic foot ulcer is not an unusual diagnosis in the healthcare system. It is a known condition with known pathways for leave and recovery. So, the role of documentation. So, one of the most powerful tools as a clinician is documentation. We all know that. Not dramatic language, not exaggeration, but clear, objective clinical description of function. For example, the patient is non weight bearing to the affected limb. Let's just call it the right limb, okay? Requires offloading device for all ambulation. Unable to perform prolonged standing duty. Sometimes you even give a certain hour, like, oh, per 5 minutes, okay? Something like that. Requires daily dressing changes and follow up. These documentations help the employer understand the patient's limitations while they're experiencing this and going through treatment and recovery. And it's not just a diagnosis. And the limitations are what drives the accommodations. So, when can a workplace become flexible? So, many patients are surprised to learn often that employers will adjust their role when given a clear guidance. So, possible accommodations are temporary seated duties. I've had patients do that, reduce standing time, remote or hybrid work, modify schedules, restricted living or walking, lifting or walking, forgive me, reassignment to administrative tasks, and additional breaks for elevation or dressing care. It's quite interesting when I hear certain patients, their different accommodations when they're on medical leave. I'm like, where do you work? This sounds, they take care of you. And then some places I'm like, oh, wow, that's kind of, ooh, wow, that's a little harsh, right? It varies, but when I hear a nice employer or a company that takes care of their people during medical leave, I'm like, that is so nice. They take good care of you. I would never leave that place, right? And, in many cases, employers are willing to cooperate when expectations are clear, restrictions are reasonable, and communication is consistent. So, when do problems arise? So, conflicts usually don't come from the diagnosis itself, they come from the uncertainty or lack of communication. So, common issues include no clear work restrictions provided, patient trying to push through without informing the employer. You'll be surprised how many patients, even right now, are on the work clock, like literally working with an active diabetic foot infection and haven't seen a healthcare provider as yet. You'll be very, very surprised. People are trying to push through it. And if you're a patient with a diabetic foot ulcer and it's not looking right, do not push through it. Go get it checked out. Because one thing I do know, okay? No, no, they're not gonna come at your bedside, okay? You gotta take care of yourself. You have to, okay? Because if you lose a toe or something because you're trying to push through and go to work until the infection gets up your leg or something like that, no, okay? Because no, because this is your life. You have to take care of yourself. You cannot take care of others until you take care of yourself. That's what also applying to the job. You cannot perform your duties on the job until you take care of yourself because then you can take care of the job responsibilities even better because you're good, okay? Employers unaware of the severity of the condition. Inconsistent attendance due to wound care visits. This is something that we actually have to deal with. Some people don't like it. The patient needs time off of work, like maybe from 12 to 1 or 2, to come to the doctor's visit, right? Even misunderstandings about recovery time, because sometimes the patient doesn't recover during that time that we fill in the documentation for the medical leave, and they might need even more surgical intervention or a different thing or structural deformity, things like that, okay? Now, a patient who hides this, like I said, this is a very dangerous pattern in clinical practice is a patient who hides their condition from work. It happens all the time. I'm just saying right now, I suggest, you know, right now there are quite a good amount of people with active diabetic foot infections right now at work. I can bet on that, okay? Because they have neuropathy, they're trying to push through it. Right now, the economy is not the best, so people are trying their best to keep whatever job they have, And, you know, patients, a lot of them it's sad though. Some people are more loyal to their job than they are loyal to their own health. And that's kind of sad. Some people will think, oh, I don't want my job to think that I can't do my job. Oh, I don't want one. I remember I had a patient who thought, like, I don't want my job to think I'm faking it. What are you talking about? They think you're faking it. That's great, incredibly toxic. If they can't trust you, trust the documentation, and think that you're faking it, some patients are even afraid of the retaliation of being on medical leave, and that's not good, right? Have patients say, "I just need to get through this week. I'll deal with it after my shift." That's why I said a lot of admissions happen after work. The patient will tell me when they come to admission or they would consult podiatry, whatever, the patient will come with a bag because they know that they're going to get admitted, and they'll be like, "Oh, I just wanted to finish my work shift, and I came right afterwards." And I'm like, it's crazy how it's a beautiful dedication, but you have to be just as dedicated to your own health and your own limb salvage of your diabetic foot, okay? And what often happens is what? The wound worsens, the infection develops, hospitalization becomes necessary, and time away from work becomes longer, not shorter, because, you know, you're trying to hide it from work. Early transparency, ugh, forgive me. Early transparency supported by medical documentation often prevents escalation, okay? Now, how do you deal with an employer who does not understand? Some employers simply do not understand the seriousness of a diabetic foot ulcer. I feel like that's very inconsiderate to not understand the seriousness of a diabetic ulcer. They may say, oh, it's just a sore in the foot, it's a minor wound, because you know why? Also, because they have neuropathy. The patient has neuropathy. They're not complaining of pain, they're not limping, right? And they're like, oh, it's something that can heal. But they don't realize the high risk of infection, the risk of amputation, the importance of offloading, the systematic nature of diabetes complications. And this is where clinicians education letters can become quite powerful. A well written note can shift the perception of the employer from this being a minor issue to a serious medical condition requiring protection, right? Now, another thing patients need to understand, job protection is not always absolute. It's important to be honest with the patient. While many workplaces are supportive, job protection is not universal. Factors that influence the outcome include what country the patient lives in, the labor laws of that country, the type of employment, union protections, employer size and policies, and the ability to accommodate the restrictions. Some roles have strong protections. Other roles operate with more flexibility for termination if the duties cannot be performed. And this is why early planning matters. Now, the importance of timing. One of the most important clinical decisions is when to intervene with work restrictions. So, delaying restrictions can lead to, like I said, worsening of the wound, increasing the infection risk, prolonged healing time, higher likelihood of hospitalization, and ultimately longer time away from work. So, early restriction does not mean failure, it means more prevention better than cure, right? And now also we have to think about the psychological layer. For many patients, yes, the fear of losing their job is tied to a great deal of deeper emotional stress. They fear the fear of being seen weak, the fear of financial instability, the fear of losing their independence, the fear of becoming a burden, the fear of stigma in the workplace. Acknowledging this openly can reduce the anxiety and improve the adherence, because I'm pretty sure everybody as wound care professionals have experienced this with the patient. You're literally going through this whole journey with the patient, because when they're following up, they're telling you about their life, telling you about the changes that are going on in their daily environment, you know? And patients are more likely to follow offloading instructions when they feel like their likelihood is being actively protected and not threatened. So, shared language between medicine and work. So, a key role for us as clinicians and podiatrists, wound care specialists is translation. So, we translate wound status means functional limitation, medical diagnosis, work restriction, healing stage, return back to work plan, right? So employers don't need every medical detail. They need clear answers like what can the employee do safely? What should they avoid? How long is this expected to be going on, right? The treatment phase or recovery phase. Clarity reduces conflict. So, instead of framing the question, will I lose my job? A more accurate clinical framing is what supports does the patient need to protect both their health and their ability to work long term? Because the goal is not just employment, the goal is sustainable function for the patient and increase the quality care of their life. And a diabetic foot ulcer does not automatically mean job loss. Most employers do not want to terminate employees during medical illness. Problems arise from not from the diagnosis itself, but from lack of communication, unclear restrictions, delayed intervention, and absence of workplace accommodations. And when all this is handled early and clearly, most patients can maintain employment in some form while protecting their foot. And I hope you enjoyed this segment of Diabetic Foot Files and diabetes and disability. And I'm Dr. G. Take care of your feet because you take care of you. And yeah, this I keep on trying to make people understand the disability aspect of diabetic foot ulcers is way more complex than it seems, okay? It's quite complex. So, until tomorrow, take care of your feet because they take care of you.